After your impacted wisdom teeth surgery, there are several pointers that we can give you that will make you have an easy recovery. Number one, we're going to give you our telephone number so that you can reach me or my staff 24 hours per day, 7 days a week, should you have any questions. Number two, you're going to be going home with gauze in your mouth over the extraction sites. And the gauze in your mouth actually, let me show you on a mandibular model. The gauze actually goes behind your teeth in this area back here, so that when you bite down, you're biting on the gauze and you're not biting on your teeth. That puts pressure in the area and allows the area to clot and heal properly. Number two, I'd like you to start with a pain pill, half a pain pill as soon as you get home with something to eat, and then the other half 20 to 30 minutes later. Taking the pain medicine in that fashion will help reduce the risk of you getting nausea. Nausea is a factor sometimes because you can swallow blood, and the blood can make you nauseous. So if you remember to take half a pain pill as soon as you get home, followed by a second half 20 to 30 minutes later, you should do well. I'd like you also to use your anti-nausea medicine. You've either been given this in one of two forms, either a crushable tablet which goes under your tongue or a suppository. The suppositories work well, the crushable tablets also work well. After you take half of your pain pill, I'd like you to either put the suppository in or the crushable tablet that goes underneath your tongue. I'd like you to use ice as much as possible. Ice is really helpful. Ice reduces swelling and ice reduces discomfort as well. You should place the ice underneath the angles of your jaws on both sides and on your cheeks, and I'd like you to use it constantly for the next 3 or 4 days. The more ice that you use, the less swelling that you'll have. It's really important. You're going to swell for 3 days, 3 days after the surgery. So if you had the surgery done on Monday, you're going to have swelling on Tuesday, Wednesday, Thursday. It'll start to go down on Friday. You've also been given a prescription for an antibiotic. I'd like you to take the antibiotic. If your appointment was in the morning, you should take the antibiotic around noontime. If your appointment was in the afternoon, you should start it at dinner. You have been given an antibiotic pre-medication that you took before you came to the office by approximately 1 hour, and this should suffice in really reducing the risk of you developing an infection. I'd like you to not do any real rinsing until the day after the surgery. To rinse as soon as you get home is going to cause the area to continue to ooze, and we want it to clot. So I'd like you to start to rinse your mouth the day after the procedure, where you're going to do rinsing with mouthwash and rinsing with salt water, where you take an 8-ounce glass of warm water, teaspoon of salt, stir that up, and rinse with that several times per day. You can also use mouthwash 1 to 2 times per day, but I won't use it any more than 1 to 2 times per day because it can cause a yeast infection in your mouth. Changing the gauze at home is usually not necessary. The areas where your wisdom teeth were are completely stitched closed. There's no holes back there. However, a little bit of blood in your saliva makes your saliva pink, and then that causes you to think you're bleeding a lot, but it's mostly just saliva. So when you get home, as long as you bit down on the gauze firmly for your ride home, you can take the gauze out and leave it out. You don't need to put it back in. Keeping the gauze in your mouth acts like a candle wick and actually makes it continue to bleed. After the first 24 to 48 hours of using the narcotic pain medicine that you've been given, it's best to switch to a non-narcotic over-the-counter medicine like ibuprofen, advil, which is another name for the same drug. Those medicines have anti-inflammatory qualities, and they frequently work better than the narcotic pain medicine. So after 1 to 2 days, you should try and switch to the over-the-counter ibuprofen advil preparations. In addition to that, should you have any further questions, please do not hesitate to call us. Thank you, and have an easy recovery.